want to see you for a follow-up next week. And listen, I know Drew is a kid with a lot of energy, but we just put a bunch of screws in your back, so you got to take it easy for a few weeks. And I am not kidding about physical therapy. You're going to need all the support you can get to keep up with that little one.
I'm going to do it. I really am.
You feeling okay? I still kind of like the idea of keeping you here another day.
No, it's been 3 days. You know, it's hard on Drew. He needs his mom.
If I weren't such a confident guy, I might have to, challenge him to a duel or something. Honey, can we get some help, please?
What the hell is happening?
What do we got? You had to open her up. Her cardium is pulling blood.
10 o'clock.
Gunshot?
No, she had spinal fusion 3 days ago.
What?
I don't know. She has no history of heart disease or risk factors. This is crazy.
Could it be a retrograde dissection?
I don't think so. No history of Marfan's or aortic widening on X-ray.
Oh, her heart's beating again.
All right, let's get her upstairs now. Throw a sterile towel on her and move. All right, people, let's go. I don't need you in there. I'm good. Okay, well, she's my patient.
You cut her heart open in your spinal fusion?
No.
Then she's my patient. All right, Henry's in CT. Somebody tell Weber where I am.
Oh, hold on.
Try this patch on the tail. We're gonna have to cut it to size.
Hang on. Sorry, my glove is stuck on something. I'm taking my hand out.
What happened?
There's a hole in my glove.
You're kidding.
Can I get Dr. Kepner a new glove, please?
Right away.
Did it break the skin?
No, I think I'm fine. Here you go.
Thank God. What the hell is that? What happened?
Show her the tray.
That's the screw that I just pulled out of your patient. It was stabbing her heart, slicing at the cardiac muscle. Every time the heart tried to beat, this thing looks like a hamburger meat right about now. Oh my God. You want to tell me how this happened? How you don't check if the vertebra is compromised before you drop a screw in it. Hey, how's it going with Henry?
They're done.
Oh.
You almost finished here?
It's gonna be a while. Torres missed a loose screw in this woman's spine. Tore apart her whole left ventricle. I've never seen anything like it. I put in a patch. I've still got to reinforce it with a muscle flap. It's
This kid's got shard glass in her eye. She's unconscious. Her pulse is low.
Mark, the glass penetrated the globe through to the orbit.
So she's going to lose the eye.
Normally, yes. I was thinking if you used a temporal approach to expose the orbit and decompress the eye, we could save it.
Well, if you do that, there's more risk of bleeding.
That's true. I could get control of the blood supply first, then enucleate the eye. But I think the eye is salvageable. Either way, it's your call.
Okay, I've got the bleeding under control. It's your turn, Dr. Canner.
All right, pull up my microscope, please.
4x4.
Speculum, saline, Dr. Shepard, 4 of silk.
Thank you.
Damn it.
Did you just push the glass in deeper? You must have speared a branch of the ophthalmic artery.
Cautery.
All right, let me get in there.
It's kind of hard right now. My hand is in her eye. Forceps?
Canner.
Come on. There. Bone fragment.
Thank you. I'm needing that.
Little bleeding is natural, Dr. Shepard. Not gonna find any more little presents in there, am I? Okay, everyone. Here comes the fun part. Clamp. All right.
I'm gonna check your pulse. Pulse is a little weak. All right, I'm gonna try to free your legs, okay?
1, 2, 3. Please.
Looks like a grade 4 liver lac. Gray, do you want to do a mental pedicle repair?
Absolutely.
Heard you lost one of your clinical trial patients today, Dr. Bailey. Sorry to hear
Was
that.
it my trial that killed him? The man suffered from von Hippel-Lindau. That's what killed him.
Well, I wasn't implying that you're trying.
Let's focus on the living patients and not the dead ones, okay? What'd you do?
Nothing, I'm just irritated.
Some spikes, CO2 levels are through the roof.
What's the problem?
He's tachycardic.
Increased heart rate. Patient's burning up. I didn't use sucks, but I did use fluoride.
Ice. We need ice.
Wait now, this is my patient.
Son, get ice now.
Right away, doctor.
Kid's about to go into organ failure. I'm pushing Dangeline.
Let's get some Kool-Aid blankets.
On it.
And turn the thermostat down here as low as it will go.
Right away, doctor. Oh my God, malignant hypothermia. Where's that ice?
Is there a cooling blanket in here?
Ray, let's repack this liver. Gel foam, what's next?
Giving Dangeline to relax his muscles. Lidocaine to calm his heart. It's all nice inside and out. Only thing left to do now is wait.
All right, let's settle in. Could be a while.
Dr. Warren, isn't malignant hypothermia genetic?
You gotta go one.
Already on it.
His heart rate's coming down. His temperature's starting to stabilize.
Usually by the time you realize it's malignant hypothermia, it's too late. Because a nice cat should probably save this kid's life.
Anybody has some JVD?
Tachycardic with muffled heart sounds.
What happened?
Sir, you're at Seattle Grace Mercy West Hospital. Your van crashed.
My woman's hurt. We need to get you examined.
Fall asleep at the wheel for a second.
Is there a flower guy?
He has an intrapericardial diaphragmatic hernia.
Oh, how did his abdominal organs get in the sac around his heart? Oh, his chest hit the wheel and crashed. Well, I'm gonna have to reduce the hernia, book an OR, bump any non-emergent patients, and find someone to scrub in with me.
Suction?
It works. Oh, sorry. Sorry. Your incision looks good.
You should be back on your feet in a few weeks, but I wouldn't recommend pulling any more all-nighters, even on holidays like today.
Trust me, brother. I'm done.
She's having a severe reaction. Sorry, Clem. Looks like I'm gonna have to give you a shot.
And? Sorry. Excuse me. Oh, sorry. Oh, Clem. Oh, honey. Poor thing.
She's gonna be fine. The doctor's gonna give her a shot. He's on top of it.
I'm glad someone is.
I didn't know.
School sends home notes all the time. It's in every newsletter. She can't even be near peanut
I
butter.
have a job, Terry. Okay, 3 kids. Excuse me if I don't read every note the school sends home.
I gave her a shot of epinephrine. It should do the trick.
Something's wrong with Clem. She's breathing funny.
Get me a size 6 CT tube.
What's happening?
Her airway's shutting down. I'm gonna have to intubate.
Oh my God.
Here you go. Some cry pressure. Just get color change. Sats are coming up.
What happened?
Anaphylactic shock. We're gonna have to keep her overnight and see how she responds.
But she's gonna be okay?
Yeah, I think so. How you feeling?
Okay.
Yeah?